look at another case study here. This one I call Your Home Care Sucks. And the reason why is because look at how bad these teeth are. They're just completely rotted out. Spent a lot of money years ago trying to fix the upper that are probably rotted away and has not learned the lesson. Or is it a case of dry mouth? I believe this is mostly a case of dry mouth and the lack of education towards what it really means to have some dry mouth going on and how fast your teeth can rot away when you don't have the proper home care instructions, or maybe you have dry mouth, maybe you just can't change the habit, maybe you don't realize the severity even if you have the instructions. So this is definitely a case where dry mouth has just completely rotted the teeth away, and unfortunately the patient is now looking at a full lower something. And knowing this is going on, you have decay here, you have decay all rotted through here, I'm not going to change the upper hybrid. The only reason why this is actually staying in or isn't broken is because there wasn't really a whole lot to chew on. This started breaking away over the years. But you could see that there's a possibility. These are old Zimmer implants and they're holding pretty well. They're holding the bone as best as possible, but there is some disease going on a little bit around there, just like you have a little of the perio here. Eventually it's going to catch up with this patient. Let's look at the treatment assessment. It looks pretty good. The bone density is really good. It's a green there. A facial bone is a light green, and all the yellows are basically the eye nerve and the ridge height and detached gingiva and things like that. So, but otherwise this case looks really great. So I would actually give this a full arch starter position. So if you're starting out looking into full arch type of work or doing this as a dentist, this is a winner for you for sure. I wouldn't tackle immediate placements on this one. I would suggest to you to try to take out all this rotted teeth here. And the one thing you might consider is making maybe make a Valplast lower and leave this one in and maybe one of these. And the reason why I say that is because this patient's going to have nothing to chew on, and having at least those two teeth while he's healing from the first set of extractions, then you got to put the implants in, then so you have two bone healing events to wait. So having one or these two teeth just holding an anchor in there for a temporary denture piece to sit in, like I said, a Valplast piece that could sit in there would be really helpful for this patient to do. You could do implants in the posterior right away, let those heal up. That's the first bone healing event. Or put the implants in there during the first bone healing event, so at least you get some stability after the first bone healing event as well. So you could do that. If you are more inclined to do immediate placements, you can do immediate placements in this case too, and you're probably going to be pretty successful there. Then I would say you're more in the skilled level of doing immediate placements and providing a restoration, not fixed, not the all-on-4 teeth in a day model. If you want to roll the dice, in my opinion, then you go for the teeth in the day, model where you put the implants in and you ligate that to the denture piece, and then you hope that the patient doesn't biomechanically overload the healing of those implants, which makes it go down. I really hate that, only because if you ever get a blowout on an implant, you lose a lot of bone in a particular area where it's ideal to have that implant placement. It really takes a long time to recover from that, and it's a real problematic situation. So don't do that methodology. If you really feel like that's necessary, you want to roll the dice on that, then I guess go ahead and do that. I would just say then maybe you're more in an advanced skill level, or you're going to have somebody probably help you at least for the first time doing these fixed hybrids onto peak abutments that gets your denture in and the whole works. So that's doable too. Whether I would do all on four locator over denture, or I would do 6 implants on the lower. Looking at him losing occlusion here and occlusion over here in the second molar position, you might consider putting an implant in there, getting his molar position here, and I think 4 implant locator case is good enough. So let's look at the CT a little bit closer, and let's look at some of the areas where we would be putting the implants in, which would be here, and I had some that I already kind of put in. These are very nice big implants. You can get them in a really ideal location, and look at how nice that would be. That would be the 4-legged stool effect I talk to patients all the time around. You want to have a nice anterior balance as well as a cantilever or the balance on the posterior. Very low maintenance situation, very easy to fix, not a problem, lots of bone, lots of quality bone, and I think this is an ideal scenario. It's just more about how are you going to transition the patient into this situation. What's good about if you put the implants in while there's teeth, what I do is take a measurement, and you're not going to use a guide here, let's say. I measure from the actual distal part of the teeth to the center point in which I want to put the implant. So I know I've got that straight down. I look at the line angle of those teeth and I go parallel. So now you should be pretty straightforward on getting into those positions in that methodology. So take your perio probe, just measure over and put the implant in there. Put the implant in there first. Don't take any teeth out yet. And then I would also do the same thing for these teeth as well. This gives you some guidance, and it eliminates some of the error that you could possibly do. So I would bury this a lot further down, something like this, down towards where the facial plate is. I would consider also grafting this case. I would be cleaning these teeth beforehand and possibly giving them antibiotics, that kind of thing. Here's the other one. So this is a really, really good case. I don't like the angulation so much here. You're trying to keep it more on the lingual wall and bring that down. So this is pretty ideal. That's why I say this is a really good ideal starter full arch case, or looking at if you're doing more immediate stuff, you want to be more conservative and see where the bone heals up around here, give them a lower denture. It'll take 2 bone healing events. This methodology, if you do immediate placement, you're looking at a single bone healing event, and you should be very successful. If you go to the all-on-4, give the teeth denture, ligate the denture in a day model, it's more expense, and you are running the risk with all of those infected areas, trapping bacteria in, causing possibly infections, that kind of stuff. I'm not a fan, like I've been saying all along, but that is possible here. This is probably people that do that probably are commenting on the video right now. So there's a fixed hybrid up here, and let's look at this number 14 site. I didn't comment anything on the treatment assessment, but things pretty good down there. And here's what it looks like up in the molar section. Not too bad. Bone looks not too bad there, but once again, I would actually take that out and graft it first, and I would wait, because here's the sinus bone up here, but we are infected on the mesial roots here. So that's taken away a lot of bone that I'd normally like to have. And that's what it looks like right before the implant. So that's not too shabby. That's a good amount of bone. So I don't think I would have a problem with this patient once it's kind of grafted and cleaned up to put the implant in, let's say probably around there. I don't know. That does look like bone. So that does look like there's a good amount of bone. Let's just do this. I'll just put a 4.2 for now. 4.2 by 10. And you would be putting a single tooth on there. Something like that. And let's just straighten that up. And it looks like the posterior here is right there. So the posterior is right there. So that's why you'd be kind of right about there. So that'll work too. So this is a great case for anybody wanting to get into full arch dentistry. Not a lot to talk about here except that the dry mouth situation, this patient should have had some better solutions, better education before witnessing the total decline and destruction of his lower teeth and having to go into this case. So I get questions about how does dry mouth actually affect restorations like this, whether it's a denture piece or a hybrid piece or something up there. It does affect the tissue in terms of how sensitive the tissue can be and how much bleeding you're going to get. So you're going to get a lot more bleeding around these types of restorations and prosthetics when somebody's experienced dry mouth. You will definitely get more bleeding and issues when somebody has perio also around teeth that are, and then you have implants and things around there too. Just the same thing, just that in dry mouth you have probably a little bit different flora, bacteria around the prosthetic, but the tissue becomes dry, it becomes more sensitive, more inflamed, because the bacteria growing around those areas just are more angry. Plus you're probably, hopefully not using alcoholic rinses, but it's a very, very difficult to overcome a dry mouth scenario, and yeah, that's an unfortunate one. But I think this patient set up for a really good outcome. I think this patient's not very far off getting back to a full chewing, and a little bit surprising that this patient had invested money into the upper arch, but had not had let this go pretty far along before now finally seeking some help to fix the lowers. So that's the way it goes. That's how people are. So anyway, thanks for joining us on this case study, and like us on Facebook and subscribe to us on YouTube, and check us out for some of our live broadcasts and check out more of our videos.